Welcome back to Global Interview Institute. Today, we're bringing you the ultimate guide to ace your care assistant interview, especially if you're a fresher entering this rewarding field. We'll cover 40 essential questions with detailed sample answers that will help you land your dream job as a care assistant. Fundamental questions. Question 1. Why do you want to become a care assistant? Sample answer. I've always been passionate about making a positive difference in people's lives. I believe everyone deserves to be treated with dignity and compassion, especially when they're vulnerable. My caring nature, combined with my patience and strong communication skills, makes me well suited for this role. I find it deeply rewarding to help people maintain their independence and quality of life while providing the support they need. When you subscribe, like, and share this video, you're not just improving your career, you're changing lives. A portion of our proceeds supports vulnerable children worldwide. Act now. Be part of something meaningful. Now, let's move on to our second interview question. Question 2. What do you think are the main duties of a care assistant? Sample answer. A care assistant's duties include helping with personal care such as washing, dressing, and toileting while maintaining the person's dignity. We assist with mobility, medication prompting when trained, and meal preparation. Documentation and record keeping are essential, as is communicating effectively with family members and healthcare professionals. Most importantly, we provide emotional support and companionship, treating each person as an individual with unique needs and preferences. Question 3. What qualities make a good care assistant? Sample answer. A good care assistant needs compassion and empathy to understand what clients are going through. Patience is crucial, especially when working with people who may take longer to complete tasks. Strong communication skills help build trust and understand needs. Being reliable and observant allows us to notice changes in health or behavior. Physical stamina is important for the demanding aspects of the role, and maintaining professional boundaries while being warm and friendly is essential. Person-centered care. Question 4. What is person-centered care and how would you implement it? Sample answer. Person-centered care means putting the individual at the center of all decisions about their care. It's about seeing the person, not just their condition. I would implement this by always asking for preferences before providing care, respecting choices even if I might do things differently, and adapting my communication style to suit each individual. I would learn about their life history, interests, and what matters to them, involving them in care planning decisions and encouraging independence wherever possible. Question 5. How would you maintain a client's dignity during personal care? Sample answer. I would always explain what I'm about to do and ask for consent before proceeding. I'd ensure privacy by closing doors and curtains, covering parts of the body not being washed, and allowing the person to do as much as they can independently. I would engage in normal conversation to help them feel comfortable, never rush them, and always knock before entering their room. Using their preferred name and maintaining eye contact at their level shows respect and preserves dignity. Question 6. How would you support someone's independence? Sample answer. Supporting independence means encouraging people to do what they can for themselves, even if it takes longer. I would assess their abilities and provide just enough support without taking over. For example, if someone can brush their teeth but struggles with squeezing toothpaste, I'd help with that specific task only. I'd use aids and equipment to promote independence, break tasks into manageable steps, and celebrate their achievements, no matter how small. Safeguarding. Question 7. What is safeguarding and why is it important? Sample answer. Safeguarding means protecting vulnerable adults from abuse, harm, and neglect while promoting their welfare and human rights. It's important because people receiving care are often vulnerable and may not be able to protect themselves. As care assistants, we have a duty of care to ensure their safety and well-being. This includes preventing harm, recognizing signs of abuse, and taking appropriate action when concerns arise. Question 8. What are the types of abuse you might encounter? Sample answer. There are several types of abuse. Physical abuse includes hitting or rough handling. Emotional abuse involves threats, humiliation, or isolation. Financial abuse is the misuse of someone's money or possessions. Sexual abuse includes any unwanted sexual activity. Neglect is failing to provide proper care. Institutional abuse happens when poor practice becomes accepted in a care setting. Discriminatory abuse targets someone based on their race, gender, disability, or other characteristics. Self-neglect is when someone fails to care for themselves. Question 9. What would you do if you suspected abuse? Sample answer. I would act immediately following the safeguarding procedures. First, I'd ensure the person's immediate safety. I would report my concerns to my line manager or designated safeguarding lead straight away, never attempting to investigate myself. I'd document everything factually, what I saw, heard, or was told, including dates and times. I would maintain confidentiality, only sharing information with authorized personnel. If my manager was involved in the suspected abuse, I'd report to a senior manager or use the whistleblowing procedure. Question 10. How would you respond if a client disclosed abuse to you? Sample answer. I would stay calm and listen carefully without showing shock or disbelief. I'd reassure them they did the right thing by telling me, but wouldn't make promises I can't keep, like saying I won't tell anyone. I would explain that I need to share this information to keep them safe. I'd write down exactly what they said as soon as possible, using their words, not my interpretation. Then I'd report immediately to my safeguarding lead and follow the organization's procedures. Confidentiality. Question 11. What does confidentiality mean in care work? Sample answer. Confidentiality means keeping personal and medical information about clients private and secure. It's about respecting people's right to privacy and only sharing information with those who have a legitimate need to know. This builds trust between clients and care providers. However, confidentiality has limits. If someone is at risk of harm, I have a duty to share information with appropriate authorities to keep them safe. Question 12. When might you need to break confidentiality? Sample answer. I would need to share information when there's a safeguarding concern, risk of harm to the client or others, or if required by law, such as a court order. If a client tells me they're being abused or planning to harm themselves, I must report this. I would always try to inform the person first if possible, explaining why I need to share the information and with whom, unless doing so would increase the risk of harm. Teamwork. Question 13. Give an example of effective teamwork in care. Sample answer. Effective teamwork might involve coordinating with colleagues during a shift handover. I would share important information about clients' needs, mood, or health changes. For example, if I noticed a client hadn't eaten breakfast, I'd inform the next shift so they could encourage lunch intake. Good teamwork means supporting colleagues when they're busy, sharing knowledge and skills, and maintaining clear communication through proper documentation and verbal updates. Question 14. How would you handle a disagreement with a colleague? Sample answer. I would address the issue professionally and privately, away from clients. I'd listen to their perspective and express my view calmly, focusing on finding a solution that benefits the client. If we couldn't resolve it, I'd involve a supervisor for guidance. The key is maintaining professionalism, never letting disagreements affect client care, and remembering we're all working toward the same goal: providing excellent care. Dementia care. Question 15. How would you support someone with dementia? Sample answer. I would use clear, simple communication, speaking slowly and maintaining eye contact. I'd be patient and never argue about their reality. If they think their mother is alive, I'd redirect rather than correct. I would maintain routines to reduce confusion, use visual cues and demonstrations, and focus on their remaining abilities. Creating a calm environment, using validation therapy to acknowledge their feelings, and learning about their past helps build connections and provide better care. Question 16. How would you handle a dementia patient who becomes agitated? Sample answer. I would stay calm and approach slowly, using a gentle tone. I'd try to identify triggers. Are they in pain, hungry, or overwhelmed? I would validate their feelings, saying something like, "I can see you're upset." I'd use distraction techniques, perhaps suggesting a favorite activity or talking about pleasant memories. If needed, I'd give them space while ensuring safety. I would never restrain or argue with them, and I'd document the incident to help identify patterns. Question 17. What is sundowning in dementia? Sample answer. Sundowning refers to increased confusion, anxiety, and agitation that some people with dementia experience in late afternoon or evening. To manage it, I would maintain a consistent daily routine, ensure adequate lighting as evening approaches, and limit caffeine and daytime napping. Engaging in calming activities in the afternoon, playing soothing music, and ensuring the person isn't hungry or in discomfort can help. I'd also look for triggers and document patterns to better predict and prevent episodes. The 6 C's of care. Question 18. What are the 6 C's of care and why are they important? Sample answer. The 6 C's are care, compassion, competence, communication, courage, and commitment. Care is our core business, providing high-quality support tailored to individual needs. Compassion means showing empathy, respect, and dignity in our relationships. Competence involves having the knowledge and skills to deliver effective care. Communication is essential for teamwork and ensuring no decisions are made without the person's involvement. Courage enables us to speak up when things are wrong and embrace new ways of working. Commitment means dedicating ourselves to improving care and patient experience. These values guide everything we do in care work. Question 19. How do the 6 C's apply to your daily work as a care assistant? Sample answer. I apply care by ensuring each person receives support that's right for them. I show compassion through kindness and understanding, even in small gestures. Competence means I keep my training updated and follow best practices. Communication involves listening actively and sharing information clearly with colleagues and families. I demonstrate courage by advocating for clients and reporting concerns. My commitment shows through consistent, reliable care and continuous improvement in my practice. Question 20. What do you know about CQC and its importance? Sample answer. The Care Quality Commission is the independent regulator of health and social care in England. They inspect services to ensure they meet standards for safety, effectiveness, caring approach, responsiveness to needs, and good leadership. As a care assistant, I contribute to meeting CQC standards through proper documentation, following policies, maintaining high care standards, and ensuring the 6 C's are practiced daily. Understanding CQC helps me maintain professional standards. Emergency situations. Question 21. How would you respond to a medical emergency? Sample answer. I would stay calm and ensure my safety and the person's immediate safety. I'd call for help, either colleagues or emergency services, via 999. I would provide first aid within my training level, never exceeding my competence. I'd stay with the person, offering reassurance, and gather information for paramedics. After the emergency, I'd complete incident reports, inform relevant parties according to policy, and participate in any debrief to learn from the situation. Question 22. What would you do if you found someone who had fallen? Sample answer. I would not attempt to move them immediately. First, I'd check for responsiveness and breathing, calling for help if needed. I'd make them comfortable with pillows or blankets without moving them, checking for obvious injuries. I would call for medical assessment even if they seem fine, as injuries might not be immediately apparent. I'd document everything thoroughly, including the position I found them in, and report to my supervisor immediately. Challenging situations. Question 23. How would you manage challenging behavior? Sample answer. I would try to understand what's causing the behavior: pain, frustration, or unmet needs. I'd remain calm, speaking in a gentle tone, and never take it personally. I would use de-escalation techniques like giving space, redirecting attention, or offering choices to give them control. I'd ensure safety for everyone involved and document incidents to identify patterns. Working with the team to develop consistent approaches and involving other professionals when needed helps manage ongoing challenges. Question 24. What would you do if someone refused care? Sample answer. I would respect their right to refuse while trying to understand why. I'd explore if it's about timing, approach, or privacy concerns. I might suggest returning later or ask if a different colleague might help. I would explain the importance of the care gently, offering alternatives or compromises. For example, if someone refuses a full wash, perhaps they'd accept help with just hands and face. I'd document the refusal and inform my supervisor, especially if it poses health risks. Question 25. How would you deal with a difficult family member? Sample answer. I would remain professional and empathetic, understanding that their behavior often comes from worry or frustration about their loved one's condition. I'd listen actively to their concerns without becoming defensive. I would acknowledge their feelings and provide clear information within confidentiality boundaries. If I couldn't resolve their concerns, I'd involve my supervisor. Building trust through regular communication and showing genuine care for their loved one usually helps improve relationships. Practical skills. Question 26. What do you know about moving and handling procedures? Sample answer. Safe moving and handling is essential to prevent injury to both clients and staff. Key principles include assessing the person's mobility and the task before moving anyone, using mechanical aids like hoists and slide sheets whenever possible, maintaining good posture with a straight back and bent knees, and never manually lifting someone alone. I would follow care plans and risk assessments, ensure equipment is properly maintained, and always explain to the person what I'm doing. If I'm unsure about any technique, I'd ask for guidance rather than risk injury. Question 27. How would you handle a client who is verbally abusive or aggressive? Sample answer. I would remain calm and professional, understanding that the behavior often comes from frustration, fear, or their condition rather than personal attacks. I'd speak in a gentle, reassuring tone and give them space if needed. I would try to identify triggers. Are they in pain, confused, or feeling loss of control? I'd never argue or take it personally. I would ensure my safety and that of others, calling for support if necessary. After ensuring everyone is safe, I document the incident accurately, including what happened before, during, and after. I'd discuss with my team to develop strategies to prevent future incidents. Question 28. What is the importance of proper documentation and record keeping? Sample answer. Documentation is vital for continuity of care, ensuring all team members know what care has been provided and any changes in the person's condition. It provides legal protection for both clients and staff, showing that appropriate care was delivered. Records must be accurate, factual, timely, and legible. I would document what I observed, not my opinions, including dates and times. Good record keeping helps identify patterns, supports care planning, and meets regulatory requirements. It's also essential for communication between different healthcare professionals involved in someone's care. Communication skills. Question 29. How would you communicate with someone who has hearing difficulties? Sample answer. I would face them directly, ensuring good lighting on my face. I'd speak clearly without shouting, using gestures and visual cues. I would minimize background noise, get their attention before speaking, and never cover my mouth. If they use hearing aids, I'd ensure they're working and properly fitted. Written communication or picture cards might help. Most importantly, I'd be patient, checking understanding, and never pretend to understand if I haven't heard them clearly. Question 30. How would you promote good nutrition and hydration? Sample answer. I would encourage regular fluid intake throughout the day, offering variety like water, juice, or tea based on preferences. For meals, I'd ensure food is presented attractively and at the right temperature. I would respect cultural and dietary preferences, assist with eating only as needed to maintain independence, and create a pleasant dining environment. I'd monitor and document food and fluid intake, reporting any concerns about reduced appetite or dehydration signs. Making mealtimes social and enjoyable is also important for well-being. Professional skills. Question 31. How do you respect cultural diversity and individual beliefs in care? Sample answer. I would learn about each person's cultural background, religious beliefs, and personal preferences through respectful conversation and their care plan. This includes understanding dietary requirements like halal, kosher, or vegetarian meals, respecting religious practices such as prayer times or holy days, and being aware of cultural preferences around personal care. Some cultures prefer same-gender carers. I'd never make assumptions based on appearance or background. I would respect different communication styles, family involvement expectations, and end-of-life wishes. By showing genuine interest and respect for diversity, I can provide truly person-centered care that makes everyone feel valued and understood. Question 32. How would you support someone with daily activities? Sample answer. I would follow the person's care plan while encouraging maximum independence. For washing and dressing, I'd prepare everything they need, letting them do what they can. I'd offer choices which clothes to wear, what to eat for breakfast. For activities, I'd learn their interests and abilities, perhaps helping with puzzles, reading, or gentle exercises. I would maintain their routine as much as possible while being flexible to their daily needs and energy levels. The goal is always to support, not take over, maintaining their skills and dignity. Safety and environment. Question 33. How do you maintain professional boundaries? Sample answer. I maintain boundaries by being friendly but professional, never sharing personal problems or accepting gifts beyond policy limits. I wouldn't give my personal contact details or meet clients outside work. I'd avoid making promises I can't keep and never borrow from or lend to clients. While showing empathy, I wouldn't become over-involved emotionally. Clear boundaries protect both clients and staff, ensuring professional, consistent care. Question 34. How would you ensure a safe environment for clients? Sample answer. I would keep walkways clear of obstacles and ensure good lighting. I'd check equipment regularly, reporting any faults immediately. Floors should be dry and non-slip mats used where needed. I would ensure call bells are within reach and mobility aids are accessible. Temperature should be comfortable, and I'd secure any hazardous items. I'd follow infection control procedures, maintain cleanliness, and ensure fire exits are clear. Risk assessments guide safety measures, and I'd report any new hazards promptly. A safe environment prevents accidents and promotes independence. Additional key questions. Question 35. How do you prioritize tasks when caring for multiple clients? Sample answer. I would prioritize based on urgency and safety. Medical needs and personal safety always come first. Time-critical tasks like medication times and appointments take priority. Then I'd address personal care needs, ensuring everyone receives essential care. I would communicate with my team to coordinate effectively and ensure no one is overlooked. Being organized with a clear plan while remaining flexible for emergencies is key. I'd also consider individual preferences where possible. Some prefer morning showers, others evening care. Question 36. What would you do if a client offered you money or a gift? Sample answer. I would politely decline, explaining that accepting gifts goes against professional boundaries and company policy. I'd thank them for their kindness and say that seeing them well cared for is reward enough. If they insist, I'd suggest they could donate to a charity or speak to my manager about contributing to activities for all residents. Small tokens like chocolates for the whole team might be acceptable depending on policy, but I'd always check first. I'd document the offer in case it becomes a pattern, as it could indicate confusion or vulnerability. Question 37. How would you encourage someone to participate in activities? Sample answer. I would first learn about their interests, past hobbies, and what they enjoyed before. I'd offer choices rather than deciding for them, and start small, perhaps just watching others participate initially. I would make activities accessible to their ability level and never force participation. Sometimes pairing them with a friend helps, or adapting activities to their preferences. I'd be enthusiastic but not pushy, respecting if they prefer quiet time. Documenting what works helps build a pattern of successful engagement. The key is making activities enjoyable, not a chore. Question 38. What would you do if you witnessed poor practice by a colleague? Sample answer. I would first ensure the immediate safety of any clients involved. If it's a minor issue and safe to do so, I might address it directly with the colleague, as they may be unaware of the correct procedure. However, for serious concerns or repeated issues, I would report to my supervisor immediately. If management is involved or no action is taken, I'd use whistleblowing procedures. I have a duty to protect vulnerable people, even if it's uncomfortable to report colleagues. I'd document what I witnessed factually. Speaking up takes courage, but it's one of the 6 C's and essential for maintaining standards. Question 39. How do you manage your time effectively in care work? Sample answer. I start by reviewing care plans and prioritizing tasks based on urgency and client needs. I create a mental schedule but stay flexible for unexpected situations. I prepare equipment and supplies in advance to save time. Good communication with colleagues helps coordinate tasks efficiently. I combine activities where appropriate. Chatting while assisting with personal care provides social interaction too. I never rush clients to save time, as this compromises dignity and care quality. If I'm running behind, I communicate with my team rather than cutting corners. Time management in care is about working smart, not just fast. Closing. Question 40. What questions do you have for us? Sample answer. I'd like to know about the client group I'd be working with and their specific needs. What training opportunities are available, especially around the 6 C's implementation? How does the team work together, and what support is available for new staff? What's your approach to person-centered care? How do you measure success in this role? What are the main challenges the care team currently faces? What development pathways are available for care assistants here? These questions show my genuine interest in providing excellent care and contributing to your team. If you found this video helpful, please give it a thumbs up and subscribe to Global Interview Institute for more interview guides across various professions. Don't forget to hit the notification bell so you never miss our latest content.